What is the normal blood sugar level?
So the normal blood sugar level, of course, refers to that it's a statement which must be qualified with regard to what sugar we are talking about. So if there is a random blood sugar level of more than 200 milligrams per deciliter, that is defined as diabetes. But even if a patient does not have a random sugar of more than 200 milligram per deciliter, it does not necessarily mean that he or she is not diabetic. The values that have been decided for diabetes are a fasting blood glucose of less than 100 milligram per deciliter, a postprandial blood glucose of less than 140 milligram per deciliter, and the HbA1c, which is the glycated hemoglobin, which is of course reflects the sugar control, the glucose control over the previous 3 months. If it is less than 5.7, then this is a non-diabetic value.
What happens if I miss the insulin dose or take an extra dose of insulin?
So the first part of the question first, if the insulin dose is missed, what will happen is that the sugar will rise. Now, how much the sugar is going to rise is dependent on a lot of other things. So, if the patient is type 1 diabetic or type 2 diabetes or type 2 diabetic, in both cases, the consequences could be different. Then, what was the size of the meal taken following the insulin that was missed? Then, what has to be considered is what was the insulin which was missed. So in a type 2 diabetic, in a type 1 diabetic, or indeed in some type 2 diabetics who are on multiple insulin injections, it could be that a patient is requiring a basal insulin that is taken once a day, and the patient could be on prandial insulin, which are insulins taken prior to the meal. So if the basal insulin is missed, then it has different implications. If the prandial insulin is missed, it will have different implications. So depending on what type of diabetes the patient suffers from, what insulin was missed, which insulin, what was the size of the meal taken following that insulin, on those factors will depend what the consequences for the patient will be. Again, another thing that should be taken into consideration is which insulin is the patient on. So some of the prior basal, some of the basal insulins and prandial insulins which were used in the past have been improved upon. There are better insulin analogs that are available today, and these newer insulin analogs tend to afford you a degree of flexibility. So even if you have forgotten the insulin, for example, you have forgotten your prandial insulin prior to the meal, some of the newer insulins can be taken immediately after the meal. But you have to see how much time has elapsed following the fact that you've missed your insulin, and a patient should consult his doctor regarding what steps to be taken. In case there is an overdose of insulin that has happened, then the consequence of course is that there could be a subsequent hypoglycemia. The patient could land up with a very low blood glucose level because of that excess dose of insulin that was taken. And therefore, with that in mind, you have to see again what type of diabetes you are suffering from, what insulin has been overdosed, and what type of insulin was it. Was it one of the newer insulins, or was it one of the older insulins? So depending on that, there might be some excess calorie which might need to be taken so as to avoid this hypoglycemia which may occur. So again, the patient should contact his healthcare provider regarding the same.
What medical conditions can cause diabetes?
So there are certain conditions affecting the pancreas. For example, chronic pancreatitis. The patient could have had a neoplasm or a cancer of the pancreas, or there could be some pancreatic calculi. So these conditions which affect the pancreas, the organ where the beta cells producing insulin are present, if that organ is damaged and that has affected the beta cells, then it is likely that the patient may develop diabetes. So disorders of the pancreas. Then there are other medical conditions such as conditions of various other hormones. For example, a condition known as Cushing syndrome, where there is an excess of cortisol within the body, which tends to raise blood glucose. So if you have Cushing syndrome with an excess of cortisol, patient might have diabetes. There is a hormone known as growth hormone within the body, which an excess of which results in conditions such as acromegaly and gigantism. A patient with these conditions may have diabetes. There are other rarer conditions like glucagonoma and pheochromocytoma, rarer conditions where some other hormones are produced in excess, which tend to raise blood glucose. So there are several other medical conditions also which can impact blood glucose.
Is it recommended to take artificial sweeteners for diabetes?
So artificial sweeteners can be taken by most patients. The approved sweeteners which are available on the market, some of them are natural sweeteners such as stevia, and others are artificial sweeteners. Those which are approved for in the market can indeed be taken. The risk of there are some postulated there are some risks and adverse effects which have been put forward, and they may play a role in a small number of patients, but for the overwhelming majority of patients, the sweeteners which are approved, which are available on the market, can indeed be taken. Of course, the fact is that the taste that these sweeteners give you might not be the exact taste that you expect out of sugar, for example. So there might be some other bitter taste, for example, in some sweeteners. So that is one problem that patients often have. But the advantage that you get is, of course, that you get the sweetness without that increase in blood glucose level that would occur if you were to take sugar. So for most patients, they can take the sweeteners that are available, that are the approved sweeteners that are available on the market.
Are there any prominent physical symptoms seen when a person's sugar goes sudden low or high?
So there are different symptoms that may occur if the patient develops low blood glucose, which is hypoglycemia. Then the patient might develop a whole host of symptoms such as tremors, such as a feeling of warmth, perspiration, a feeling of intense sudden hunger or dizziness. So these should warn the patient that he is suffering from hypoglycemia, and appropriate measures should be taken to correct the hypoglycemia immediately. If in the other condition, which is hyperglycemia, where the blood glucose level is very high, again the patient will develop symptoms of increased thirst, increased urination frequency, tiredness, might develop blurring of vision, might develop tingling over the extremities of the body, and these should warn the patient that the blood glucose level is perhaps too high.